Hi, my name is Gretchen Winnington, and this is for Fort Hays State University, Nurse 916, Nurse Practitioner Roles in Primary Care. And my presentation is on the Kansas Advanced Practice Nurses Association, the KAPN. What is the KAPN? The KAPN is dedicated to assuring that all Kansans have access to cost-effective, high-quality care provided by advanced practice registered nurses, certified registered nurse anesthetists, certified nurse midwives, clinical nurse specialists, and nurse practitioners. The mission statement for the KAPN is to promote advanced practice nursing excellence in practice, education, and research, to collaborate with others in shaping the future of healthcare, including health professions, agencies, organizations, and individuals, to provide leadership and direction for advanced practice nurses in the areas of legislation and regulation to meet the organization's missions, to build a positive image of the advanced practice nurse role, and to be a valuable, reliable information resource regarding advanced practice nursing. Who is the KAPN? KAPN is open to all currently licensed and active clinical nurse specialists, CNS, certified registered nurse anesthetists, CRNAs, certified nurse midwives, CNM, and nurse practitioners, NPs. Regular members in good standing have voting privileges. There are 3 additional categories of membership, which include the first one, a student or retired. This category of membership is open to all registered nurses enrolled in an entry-level program that prepares advanced practice nurses, programs for initial certification as a CNS, CRNA, CNM, or nurse practitioners, or those retired from active practice as an advanced practice registered nurse. Students and retired members have no voting privileges. The second one is the associate. This category of membership is any non-APN individual interested in fostering the mission of KPAN. Associate members have no voting privileges. The last one is supporting. This category of membership is open to any corporation, agency, institution, or organization that supports the KAPN and financial support. There is no voting privileges for supporting members. This slide contains some pictures and information about the board of directors. The president is Marilyn Douglas, DNP, APRN, FNPC. Vice president is Holly Cobb, APRN. Secretary is Benjamin Cochran, DNP, APRN, MPC. Treasurer is Marie Coffin, DNP, APRN, FNP, BC. The nurse midwife director is Sally Prickett, APRN, CNM, BC. Nurse practitioner director is Michelle Knowles, MSN, APRN, FNP, BC. The certified registered nurse anesthetist director is Kyle Nevels, CRNA, DNP. The clinical nurse specialist director is Betty Smith Campbell, PhD, APRN, CNS. And the APRN director at large is Rhonda Eagleson, MSN, APRN, FNP, BC. The following is a breakdown of how much it costs to become a member of the KAPN. For a clinical nurse specialist, a certified registered nurse anesthetist, certified nurse midwife, and nurse practitioner, the members in good standing, the fee would be $195. As for the student or retired membership, this category of membership is open to all registered nurses enrolled in an entry-level program that prepares advanced practice nurses programs for those retired from active practice as an APRN, and they have no voting privileges, and the cost for this membership is $50. The RN associate category is for RNs that are not enrolled in an advanced practice nursing program, and the fee for this is $50. An associate membership, this category is any non-APN individual interested in fostering the mission of the corporation, and their fee is $150. A supporting member for this category is open to any corporation, agency, or institution that supports the corporation with financial support. And for this membership, the fee is $250. The KAPN is a newly formed organization called the Kansas Advanced Practice Nurses Association. The members of this organization felt it was time to properly form as a professional organization with the vision to represent and promote advanced practice nursing excellence in practice, education, and research in Kansas. This committee grew from the former Kansas APRN task force with a continued plan for legislative changes so that Kansans have increased access to APRN-directed healthcare, and to also advocate and participate in future health policy activities involving APRNs. The members strongly believe that all four roles of the advanced practice nursing, anesthetist, clinical nurse specialists, midwives, and nurse practitioners should support each other and speak as a unified voice. The executive board of KAPN include representatives from each of the four roles, as well as 4 elected officers. This is a marvelous time to be in healthcare, as there are many changes on the horizon. As a combined group, the 4 roles of the profession, anesthetist, clinical nurse specialist, midwives, and nurse practitioners, contribute enormously to the health of Kansas. Think about the breadth and depth of services that nurse practitioners provide. Some of these include prenatal cares, attending births, physical exams, acute and chronic disease management, anesthesia, pain management, mental health management, emergency care, hospital inpatient management, collaboration with specialists, patient education, long-term care management, public health cares, research, student education, and administration. We are critical in helping our patients through their lives of healthcare challenges. Most of all, nursing is our common base. According to the 2015 Gallup survey, nurses again are the most trusted profession. It is that trust that rightfully places advanced practice nurses in the conversation about Kansas healthcare policy. We have been involved all along in our patients' lives. We listen, we counsel, we diagnose, we educate, we heal, and most of all, we care. Advocacy is our strongest quality as we speak up for the betterment of healthcare in Kansas. Quality, access, and value has always been part of our mission. The advanced practice nurse provide vital and crucial healthcare services to rural areas and underserved populations. Our contributions to present healthcare is essential. It is well known that there are shortages of healthcare providers in primary care, mental health, and obstetrics. APNs have filled some of the gap and have proven that APN-directed cares are comparable to physician-directed cares. The Institute of Medicine contends that nurses should practice to the fullest extent of their training and education and not be hampered by state regulations. It is important that all of us support this organization, and we need to encourage each other to work to our fullest extent of education and training. That includes supporting and participating in this professional organization, as well as your role organization. KAPN's emphasis is at the state level, supporting Kansas health issues, being a resource regarding Kansas advanced practice nursing, and supporting Kansas APN education and training. As the organization grows, future activities will include educational conferences and meetings for all APNs. The organization will be known as the go-to for APN information. Opportunities for participation will abound in all aspects of this organization. This organization welcomes students to join and participate to learn about the profession and take advantage of opportunities for projects about health policy. The KAPN website has a lot of different information, including career opportunities. You can look up about the board members. It has news and announcements, and on this slide I included some of the most recent information about the Medicaid expansion updates and the KAPN House Bill 2066. It is also important to identify the different categories of the APRN. Who are advanced practice registered nurses and what do they do? An advanced practice registered nurse are registered nurses who received additional education in the form of a master's degree or higher, who possess knowledge, skills, and a scope of practice reflecting their educational preparation. There are 4 advanced practice nursing roles. The nurse practitioner, which is an advanced practice registered nurse who provides high-quality healthcare services. They diagnose and treat a wide range of health problems. NPs are a member of the health delivery system, practicing autonomously in areas as diverse as family practice, pediatrics, internal medicine, geriatrics, and women's health care. NPs are prepared to diagnose and treat patients with undifferentiated symptoms, as well as those with established diagnosis. Both primary and acute care NPs provide initial, ongoing, and comprehensive care, which includes taking comprehensive histories, providing physical examinations, and other health assessment and screening activities, and diagnosing and treating and managing patients with acute and chronic illnesses and diseases. This includes ordering, performing, supervising, and interpreting laboratory and imaging studies, prescribing medication and durable medical equipment, and making appropriate referrals for patients and families. Clinical NPs care include health promotion, disease prevention, and health education and counseling, as well as the diagnosis and management of acute and chronic diseases. Certified Registered Nurse Anesthetists, or the CRNA, are prepared to provide the full spectrum of patient's anesthesia care and anesthesia-related care for individuals across the lifespan whose health status may range from healthy through all recognized levels of acuity, including persons with immediate, severe, or life-threatening illness or injury. This care is provided in diverse settings, including hospital surgical suites and obstetrical delivery rooms, critical access hospitals, acute care, pain management centers, ambulatory surgical centers, and the offices of dentists, podiatrists, ophthalmologists, and plastic surgeons. Certified Nurse Midwives, CNM, the Certified Nurse Midwives provides a full range of primary health care services to women throughout the lifespan, including gynecological care, family planning services, preconception care, prenatal and postpartum care, childbirth, and care of the newborn. The practice includes treating the male partner of their female clients for sexually transmitted diseases and reproductive health. This care is provided in diverse settings, which may include home, hospital, birth center, and a variety of ambulatory care settings, including private offices and community and public health clinics. And the last one is the clinical nurse specialist. The CNS provides patient care and expert advice in one of several nursing practice specialties related to setting, such as critical care, population, pediatrics or women's health. A type of care would be psychiatric or rehabilitation. A disease or medical subspecialty would be diabetes or oncology, or other types of medical problems, such as pain or wounds. The CNS is responsible and accountable for diagnosis and treatment of health illness states, disease management, health promotion, and prevention of illness and risk behaviors among individuals in families, groups, and communities. This concludes my presentation on the Kansas Advanced Practice Nurses Association, which I want to reiterate that this organization is dedicated to assuring that all Kansas have access to cost-effective, high-quality care provided by advanced practice registered nurses. Thank you.